It was a cluster that plunged the entire northwest into lockdown. 8 months on, finally, some answers.
The outbreak could have been far worse if it was not for the mature and sensible cooperation of the community in Burnie.
Greg Melick has released his report into the northwest coronavirus outbreak. 138 of Tasmania's 231 confirmed cases have been linked to the cluster. The outbreak has been traced to 2 passengers from the Ruby Princess. 80 healthcare staff were infected, as well as 25 patients and 33 others. It led to at least 10 deaths.
I don't believe that this report, or any report of its kind, will provide solace to somebody that lost somebody during this pandemic.
The report found that closing the Northwest Regional Hospital and Northwest Private Hospital was a difficult but correct decision. That Tasmania's long-standing issues with parochialism made dealing with the outbreak challenging, and that staff-to-staff transmission was a major factor in the cluster, with staff meeting in crew rooms, even hugging when things were difficult.
This was the first time in Australia that this had happened. So they didn't have any prior learning to go on. And it's human nature in times of crisis to congregate.
Hospital staff said they felt afraid to speak up for fear of retribution.
There were some instances of lower to middle managers overreacting or being aggressive.
And certainly the communication pathways was a key concern raised by our members about how to escalate concern, how to have key messages translated.
The independent review found while there was enough personal protective equipment to go around, masks provided to staff were up to 15 years old and sometimes defective.
The other problem with PPE is that some people's faces just don't fit.
What this report highlights is that there is under-resourcing and underfunding of health.
The report makes 37 recommendations. Among them is that hospitals be renovated to allow for social distancing among staff, big improvements in communication to staff and the broader community, and that the Health Department should implement electronic systems for medical records and staff rosters to help improve contact tracing.
There is a real problem of paper-based roster systems because you can't interrogate them.
And the government will support all of these recommendations either fully or in principle.
We've already seen action start. We've seen action start in the area of IT.
Something Tasmanians hope aren't put to the test anytime soon. Emily Baker, ABC News.